Hello viewers, welcome to my YouTube channel. Today I am going to explain you the blood clotting mechanism. Okay, so what is blood clotting? Sometimes we have incision on our, we may be injured on our skin. That at that time our blood vessels get damaged. Okay, there is a incision there. There may incision cause, and that incision may, by that incision, blood plasma leave out, and then the blood volume get dropped, and the tissue become fade, and we may die. And if the blood vessels from the blood vessels, if the blood corpuscles, blood cells live out, then no longer we oxygen carrying capacity may we have. So we need to fix that incision point quickly. Okay, and that fixation is actually the blood clotting. So there are a couple of steps are there in the blood clotting mechanism. So before going into the process, just look over the definition of blood clotting and hemostasis. So what is blood clotting is actually known as the coagulation. It's also called coagulation, and is a process that stops bleeding from a damaged blood vessel. Okay, and homeostasis, that is a natural is the body's natural process that stops the bleeding and repairs the injured blood vessels. So let's come in detail about the clotting procedure. 3 steps are there in the blood clotting mechanism. The first step is vascular spasm. So look at the picture. This is the blood vessels, and here is the incision part, that is the blood vessels get damaged. Okay, now what happened? By this incision point, by this damaged area, the blood may leave out. So immediately what happened? The vasoconstriction occurred. What is vasoconstriction? That means the vessels constrict, become narrowing immediately. They don't allow much more blood to pass through across the vessels. If there is less amount of blood will pass through the vessels, then less amount of blood may come out. That's why immediately vasoconstriction occurred. The blood vessels get constricted from both of the sides. And the factors that causes the vascular spasm, vasoconstrictions, that are prostaglandin, thromboxane A2, serotonin, noradrenaline, and endothelin. These are the components that stimulate the vasoconstriction. Then for the next step, platelet plug, that actually going to happen. Along with the endothelial layer, this is the endothelial layer. Along with the endothelial layer, there is a connective tissue, and that connective tissue is called the collagen. Collagen tissues are there. Okay, so when the vessels damaged here, the collagen fibers get opened. Okay, that collagen fibers get open, and that collagen fibers are negatively charged. Now, here the different types of blood cells are there, RBC, WBC, and also there is a special cells, that is the platelets. That platelets also called the thrombocytes. Thrombocytes. That cells come attached with the collagen fibers. Now what happened here? Endothelium and platelets, they together activates a factors named von Willebrand factors. That factors actually help the thrombocytes, the platelets, to attach at that collagen fiber. Let's see. Look at that diagram. Actually, platelets are also negatively charged and collagen fibers are also negatively charged. So how could both the negatively charged particles get attached? That's why here von Willebrand factors plays a very important role. They come in that place and they hold one hand with the collagen fiber, and the another hand they hold the platelets. That's why the platelets aggregate at that place, and the formation of platelet plug happen there. Okay, so that factor von Willebrand is very important here for the formation of platelet plug. Sometimes what happens, some peoples are get mutated and that factor is not produced. Okay, in that sense, platelets not get aggregated with the attached with the collagen fibers. And some people are there, they have overexpressed by the gene of the that gene, they produce more von Willebrand factors, and there that factors pass with the blood plasma and they catch the platelets, and they form a clot within the blood vessels. The blood clotting shouldn't be there, but due to the overexpression of that gene, they form clot within the blood vessels, over production of that factor by the expression of particular gene. So that kind of disease where this factor is affected is called the von Willebrand disease. Okay. Now the third step, that is coagulation phase or clotting. Now the platelets get aggregated here. Now how the clot will form? The coagulation phase or clotting phase is divided into two phase, that is the intrinsic and extrinsic. Intrinsic is that when the endothelia get damaged and collagen is there and presence of platelets is there. That is intrinsic factor, where the blood vessels gets damaged. And extrinsic is what? Where the tissue get damaged. When tissue get damaged but blood vessels are not damaged. And the factors transfer a signal to the blood vessels for the formation of clot apparatus. That is the extrinsic factor. The signal is coming from the external side, from the tissue for formation of clot. But here intrinsic is that where the blood vessels damaged. So what is intrinsic? Tissue damaged but blood vessels are not damaged. Damaged tissue stimulate some factors that causes blood clotting into the blood vessels. So let's come in the steps. What are the steps are involved within the intrinsic and extrinsic? Now look very carefully. Both of the phase come and meet at a point, and then they follow the same pathway. Okay, and for this process there are some proteins, 13 types of factors are responsible, and that 13 types of factors are actually proteins and they are produced in liver. If someone have any liver disease, then they may suffer in blood clotting mechanism. Okay, so these are the 13 factors. Okay, here intrinsic where the damaged blood vessels is there, and extrinsic damaged tissue. Now here we start from the back, 12, from factor 12. So here damaged blood vessels which have the collagen, presence of platelets, okay, these and damaged blood vessels, these three together activate the factor 12. The factor 12 is inactivated, and by the presence of the collagen, presence of the platelets, they get activated by them, form the activated 12. Now this activated 12 transfer the inactivate 11 factor to activate 11. Now from factor 9 it is inactivated, now it's become activated by activated 11 factor. Okay, now what happened here is both the factors come, so I marked it as a cross. That means here is a inactivated 10. That inactivated 10, now we have already discussed about 12, 11 and 10. Here 10, and that inactivated 10 get activated by the factor 9, active 9. Okay, but 9 can activate the factor 10 with the help of 3 things, that is vitamin K, calcium ion and factor 8. So vitamin K and calcium is very important here to activate the factor 9. Now factor 8 and factor 9 form a complex that activate the factor 10. Now come to the extrinsic. What happened here? Damaged tissue, they form the tissue factor that is also called the thromboplastin. That thromboplastin activate the factor 7. Here activated factor 7 also come at this stage to activate the factor 10. But 7 can activate it with the with these 3 components, vitamin K, calcium and tissue factor, that is thromboplastin. Now factor 10 get activated by the vitamin K, calcium and factor 5. Okay, so we can understand that vitamin K, calcium are very important for the blood clotting process, for the blood clotting steps. Okay, because the factors are activated by the presence of these 2 substances. Now what happened? Factor 10 now get activated. That activated factor 10 transfer the prothrombin into thrombin. That prothrombin is the factor 2. Thrombin. Prothrombin is converted into thrombin. Now thrombin get activated by vitamin K and calcium. That thrombin also convert the fibrinogen to fibrin. Fibrinogen is factor 1. Now fibrin, this form the clot by the activity of the factor 13. Okay, so this is the steps of blood clotting procedure, blood clotting mechanism. Here factor 3, factor 4 and factor 6, these are the 3 factors are negligible. Okay, you may pause my video and take a screenshot of that page that make you better understand. We can see that factor 2, 7, 9 and 10. For these 4 factors, vitamin K and calcium, the role of vitamin K and calcium is very important. A very vital role. Vitamin K and calcium play a very important role for these 4 factors, 7, 2, 9 and 10. But why they are important? Let's see. These 4 factors are protein. As they are protein, so they form a polypeptide chain. Suppose these are amino acids and form a polypeptide chain. What vitamin K does? Vitamin K carboxylize the protein, these factors, carboxylize these factors. What is carboxylation? They release carbon dioxide and form a COO. Here is a negative ions is there. They form the negativity here. But why vitamin K form this type of structure? They form that kind of structure that calcium can attach with the factors. Okay, as calcium is a positive and here is a negative, so here calcium come and attached with this factor. Okay, so this factor carbolizes, vitamin K carbolizes the factor, and that calcium can attach with the factor. Now what happened? Look at the blood vessels here. Is the blood vessels, and here is the collagen fibers are there. They are also negative. Now calcium in its one hand they attach the factors, and in its one hand they attach the negative collagen fibers. Okay, that's why they form the clot. Here vitamin K makes all the factors negative, and calcium can bind with this factor, and then they bind in one hand with the factors and another hand with collagen fibers. That is the importance of vitamin K and calcium in the blood clotting mechanism. Here I want to mention one thing, that for the newborn baby, as they have a lack of vitamin K, they have to inject vitamin K injection. For if they have any incision, if they have any blood vessel damage, then for the newborn baby vitamin K injection is pushed. Okay, and for the blood bank, when the blood is stored there, within the tube citrate salt is used, sodium citrate, and that citrate is also negative charged, and when we pour blood here, calcium deposited there. As calcium deposited, so they not take part in clotting, so blood will not clot. That citrate salt actually form a complex with the calcium. As calcium is a positive charge and the citrate is negative, so calcium form a complex with the citrate salt, and the blood that are actually poured in the tube, that blood will not clot. In that way we can store blood within the blood bank and also collect blood within the tube. Okay, so that's all about the blood clotting mechanism. If my video help you to clear the idea about the clotting mechanism, definitely give a like. That makes me inspired. Very soon I will meet with new topic. Till then, take care. Thank you for watching.